Lower back discomfort, particularly related to lumbosacral joint stiffness, becomes increasingly common after age 50, often stemming from decades of movement patterns rather than aging itself. Today we're covering 4 neuromuscular reset movements and how they address lower back pain by restoring mobility to the lumbosacral junction, the critical point where spine meets pelvis. These movements target prone elbow press for spinal extension, supine knee rotations for gentle mobilization, bird dog with knee hover for deep core activation, and standing hip circles for pelvic stability. When practiced correctly and consistently, they can help restore natural spinal alignment, improve functional movement, and reduce chronic lower back discomfort. Before we begin, this is educational content, not medical advice. Always consult your healthcare provider before starting new exercises, especially if you have acute back injury, severe spinal conditions, recent surgery, or chronic pain requiring ongoing treatment. Understanding lumbosacral joint dysfunction after 50. Most lower back pain after 50 originates not from muscles but from restricted joint mobility, specifically the lumbosacral junction where spine meets pelvis. This joint acts as shock absorber for every step, sitting position, and bending movement. Over years, habits like slouched sitting, elevated feet positions, or working from bed gradually push this joint out of optimal alignment, creating what movement specialists call joint stacking, where uneven pressure compresses single spinal segment. When this segment becomes rigid, nervous system generates protective pain signals even without actual tissue damage. Walking and general activity may maintain cardiovascular health but typically don't provide specific movement patterns needed to restore lumbosacral joint mobility. These targeted movements address that gap by retraining spine through extension, rotation, stabilization, and pelvic control. Movement 1, Prone Elbow Press for Spinal Extension. The prone elbow press reverses effects of slouched sitting by gently extending spine and decompressing lumbosacral junction. Lie face down on firm surface like yoga mat. Rest forehead down and breathe naturally. Slowly press up onto elbows, keeping hips and pelvis on floor, creating gentle backward curve in spine. Hold position for 30 seconds while breathing calmly. Lower if sensation feels too intense, then return. Progress to 1 minute hold as comfortable. Optional variation includes bending one leg and slowly rotating it across other side. Skip if experiencing sharp pain, but mild stiffness indicates back needs this movement. Research shows this position loads spine in extension, reactivating spinal stabilizers and reducing pain signals from compressed tissues. Many experience relief within 20 to 30 seconds as joint decompresses. This movement returns control by restoring motion in foundational spinal joint, influencing hips, legs, and balance. Daily practice for just 1 minute can retrain back from chronic stiffness toward natural mobility. Movement 2, Supine knee rotations for gentle mobilization. Supine knee rotations gently mobilize spine through rotation while reassuring nervous system that movement is safe. Lie on back with knees bent, thighs vertical, calves relaxed. Arms rest gently out to sides for balance. Slowly let both knees fall together to one side only as far as comfortable, without forcing to touch surface. Return to center, then guide to opposite side. Move in slow relaxed rhythm like pendulum for 30 seconds or until feeling light release. Range may only reach halfway down, which is acceptable. Goal is gentle mobilization through rotation, not forcing range of motion. Especially effective before bed or upon waking when stiffness is most noticeable. This movement reintroduces rotational movement lost from years of linear habits like sitting, walking, standing. Joints contain mechanoreceptors that detect gentle movement and send calming signals to brain, reducing pain perception and muscle tension. This neuromuscular communication tells spine it's moving again and safe. Over time, this resets baseline so previously painful movements become easy, morning stiffness fades, and body learns to relax instead of brace. Movement 3, Bird dog with knee hover for deep core activation. Bird dog with knee hover reactivates deep spinal stabilizers, particularly multifidus muscles that often become dormant after 50. Begin on hands and knees with hands under shoulders, knees under hips. Gently engage abdominal muscles as if bracing for light tap. Extend right arm straight forward, thumb up, while hovering left knee about 1 inch off ground. Hold 5 seconds maintaining steady torso without rocking or twisting. Return to start, then switch sides. Repeat several times each side until mild fatigue, 3 times weekly. Progress to lifting opposite arm and leg simultaneously only when maintaining perfect form. After 50, especially with history of back pain, brain often turns off multifidus muscle group, causing spine to lose internal stabilizers. Body then uses wrong muscles for stabilization, creating tension and pain. This movement re-engages stabilizers through what movement specialists call reflexive stability, where body automatically protects itself through deep muscle activation when proper neural pathways are reawakened. Research shows this improves not just pain but balance, fall prevention, and walking stability, all declining after 50 when deep core muscles go dormant. This rebuilds spine's internal defense system for genuine stability from inside out. Movement 4. Standing hip circles for pelvic stability. Standing hip circles strengthen deep hip stabilizers essential for keeping pelvis level and spine aligned during daily activities. Stand tall facing wall, feet shoulder width apart. Place fingertips on wall for balance without leaning weight. Shift weight onto left leg keeping it slightly bent. Lift right leg slightly off floor and draw slow wide circles with knee or foot, moving forward, out to side, around and back. Move slowly and controlled like moving through water. Continue 30 seconds or until light fatigue in outer hip muscles, then switch legs. As strength improves, try tilting pelvis slightly outward during top of each circle for increased activation. This targets gluteus medius and deep hip stabilizers. When these weaken after 50, pelvis tilts with each step, putting constant stress on lumbosacral joint. Most people never train these muscles directly. This closed-chain balance exercise retrains proprioceptive system, the internal sense-informing brain where body exists in space. Research shows improved proprioception decreases back pain and dramatically reduces fall risk. After 50, falls become potentially life-altering events. Regular practice quietly rebuilds pelvic stability, postural control, and spinal alignment without requiring equipment or high-impact movement. Performing movements safely and effectively. Start conservatively with one movement daily, focusing on proper form over intensity. Prone elbow press, 30-second hold, progress to 1 minute. Supine knee rotations, 30 seconds gentle rocking. Bird dog, 5-second holds, several repetitions each side. Standing hip circles, 30 seconds each leg. Practice movements once daily, ideally same time for consistency. Essential reminders: move slowly with control, never force range of motion, breathe naturally throughout, stop if experiencing sharp pain, mild discomfort or stiffness indicates need for movement. Progress gradually over weeks, not days. Consistency matters more than intensity. Safety considerations and precautions. Do not perform these movements without consulting healthcare provider if you have acute back injury or sciatica, recent spinal surgery, severe osteoporosis, spinal stenosis or disc herniation, uncontrolled pain requiring medication, or conditions affecting balance or coordination. Even for healthy older adults, start conservatively and progress gradually. Stop if experiencing sharp shooting pain, significant joint discomfort, numbness or tingling, or dizziness. Mild muscle fatigue and stiffness are normal, acute pain is not. Realistic expectations and timeline. Benefits develop progressively over weeks to months. Weeks 1 to 2, learning proper movement patterns, beginning to feel targeted areas, establishing daily habit. Weeks 2 to 4, improved movement quality, beginning functional improvements, reduced morning stiffness. Weeks 4 to 8, clearer functional benefits, noticeable mobility improvements, better confidence in movement, reduced pain frequency. Weeks 8 to 12 and beyond, maintain progressive improvements, established sustainable practice, clear functional benefits supporting daily activities. However, stopping practice leads to gradual return of stiffness, emphasizing importance of consistent practice. Integration into daily routine. These movements integrate easily into daily routine. Ideal timing includes morning before getting out of bed for supine rotations, after waking for prone press, mid-morning or afternoon break for bird dog, evening for hip circles, or combined into single 5-minute session. Consistency matters more than perfect timing. Choose times working reliably for your schedule, enabling sustainable daily practice. Complementary practices for spinal health. These movements work best combined with regular walking, maintaining cardiovascular health, proper sitting posture with lumbar support, taking movement breaks during prolonged sitting, adequate core and hip strength exercises, and addressing any contributing factors like tight hip flexors or weak glutes. Comprehensive approach addresses multiple factors affecting lower back health and function. Monitoring progress. Track both movement quality and functional improvements. Movement metrics: increased hold duration, improved range of motion, better balance and control, reduced need for wall support in hip circles. Functional improvements: reduced morning stiffness, easier standing from sitting, better walking endurance, improved confidence in movement, decreased pain frequency and intensity. These functional markers indicate meaningful improvements supporting independence and quality of life. Conclusion. These 4 neuromuscular reset movements provide evidence-based benefits for adults over 50, including restored lumbosacral joint mobility, improved spinal extension and rotation, activated deep core stabilizers, enhanced pelvic stability, and reduced chronic lower back discomfort. These movements require minimal space, take only few minutes daily, and can be performed safely at home. Start with one movement using proper form. Practice consistently once daily. Progress gradually to all 4 movements. Use safety precautions always. Combined with regular activity, proper posture habits, and comprehensive fitness approach, these movements support continued spinal mobility, functional strength, and independence after age 50. Thank you for watching. For specific concerns about appropriate movements for your situation, consult healthcare provider or physical therapist for personalized assessment and guidance. Subscribe for evidence-based information on functional movement and pain management for older adults, practical guidance prioritizing safety while helping you maintain mobility and independence through simple, effective techniques.